there, my name is Jessie, and I am here to talk to you about the difference between sex and gender. So, this has become a recent topic with my son and I. He is younger and has started to notice that mommy and I don't have the same parts. So, he's been asking why. And so, I am taking this time to explain to him that mommy is a girl and Hunter is a boy, so we have different parts. This has gotten me to reflect on some past experiences that I have come across in my time in the healthcare field. So several years ago, I had a young male patient that would come into the office and would show interest amongst us girls of our makeup, our hair, our jewelry, always asking, oh my goodness, where did you get this? So we would always share tips, and he would tell us, oh, I got the cutest thing at such and such store. So we always kind of knew that there was a little bit of interest. Well, as time went on, he got to his next couple appointments. His hair would be a little bit longer. He would have a little bit more makeup on. Each time he would come in, just a little bit more feminine. So one day he comes in, he comes right up to my desk. He is wearing a skirt, a blouse, some thigh-high boots, makeup done, his hair's long, it's curled, nails painted, looks like a totally different person. Tells me what name I have in the system, then proceeds to tell me I am choosing to go by Lizzie now, and I need to be referred to as her. I tell Lizzie, great, not a problem. I will get it changed in the system and let the staff know in the back so that we can keep you as comfortable as we can. This was a very good teaching point for myself and the staff, that if a patient comes forward and tells you, this is how I am choosing to identify myself, that we respect it. It was hard in the beginning, knowing this little boy from a very young age, going from calling him by his birth name to now referring to him as a her, as well as completely changing the name. But in order for him to be comfortable and us to keep him happy, we changed how we did things. This was good for the staff because he was more comfortable coming in and discussing with us treatment plans and options because we were accepting of her, Lizzie. So, after discussing things with Lizzie, she was telling me she always felt that she was meant to be a girl. Though she was born as a boy, she never fully identified that way. Just because she had the male parts, she always felt deep down that she was meant to be a girl. But with that being said, no matter how she identifies, her healthcare needs will always be that of a man because of her genetic makeup. Men and women's bodies process food and medication no differently than what they are born as. So even if this young man identifies as a woman, her body is still going to process as a man's would. Now you may be wondering, why is it such a big deal to know the difference between sex and gender, especially in the healthcare field? Well, it is very important to know the true gender of the patient because of different medical complications. I found a really good quote by an author, Michael Philper, in the article, Why Gender-Specific Medicine Matters in the Emergency Department. The quote goes, "Gender-specific medicine is not some feminist push and is not just about women, but women and men equally based on very fundamental knowledge that men and women are different in every system of the body in ways that we never expected. If we assume that men and women are interchangeable, we are going to make gross errors and it will eventually cause loss of human life." The article goes on to discuss some of the differences between men and women and how things as simple as heart attack symptoms vary between the sexes. For example, women have very different symptoms than men. It is said that women feel pressure and pain in their upper and lower backs, as well as in their arms, their stomachs, a little bit of shortness of breath, difficulty breathing. Whereas men have the hallmark, I feel like an elephant is stepping on my chest hurts so bad, my arm is hurting, totally by the book symptoms. Many women have these issues undiagnosed because they brush it off thinking, oh, I slept wrong, my neck just hurts today. Whereas this is a true life-threatening issue. Along with just different signs and symptoms of severe medical issues, medications also have a different impact on your body based on your sex. Liquids and solids stay in a female's system longer than they do in men's, which allows greater absorption of the medication. Also, within the female liver, Valium, a very normal pain medication prescribed, is broken down more quickly in women than it is in men, which sometimes causes women to need more medication than men. They might take more frequent doses and need a higher strength because their body's absorbing it a little bit faster than men do. No matter what gender you identify by, it just goes to show that your body's going to react differently no matter what your genetic makeup is. And oftentimes there is a lot of lack of therapy and management or prevention in these situations. These people that are seeing themselves as a different gender don't have anywhere to turn. This causes a lot of anxiety and depression that they keep pent up most of their lives due to rejection and, family telling them that it's wrong and not accepting them. There are ways to educate yourself and your staff on different ways to approach these different situations. When somebody comes to you and says, I identify as a female, but I am a male. My family does not accept this, and I need to know up front if you do, because if not, I need to find somebody else. This is a perfect time for you to give this person the reassurance and understanding that you treat people for their better well-being, that no matter how they come to you, they will be treated equally. Also, ensuring that your staff is well trained on how to handle these difficult conversations and situations, as well as pushback from patients, is crucial in order to help the patient feel comfortable and open to talking to you because they know that they are in a judgment-free zone. The patient needs to understand that they are going to be treated equally and respectfully by you and your staff. And if there's a member on your staff that doesn't believe that they can handle a difficult conversation that way or be able to remain neutral on the situation, it is best to either train them to be able to do it or to make sure that somebody else is handling it. Though it may not be the easiest conversation to have, it is best for you, your staff, and the patient to be sure that you are level-headed and open-minded. It is extremely important that the patient is comfortable because they will not accept treatment unless they are. No matter how somebody identifies themselves, whether it be female, male, or, occasionally a little bit of both, it is your job as the healthcare professional to be well educated and trained on how to have these difficult conversations, no matter who you're speaking to. Everybody needs to be treated equally, no matter the circumstances. Hopefully this gives you a little bit of insight on sex versus gender. I look forward to talking to everybody more.